Good morning, gorgeous humans, and welcome to part 3 of my pregnancy and fertility series. So, you're pregnant, or you're planning to get pregnant. What do you do next? Well, the first thing that you would do is go and see your GP, and they'd make you pee on a stick again. And your GP will tell you, well, you've got two options. You can either go private or you can go public. It means that if you go private, you would deliver at a private hospital. You have an OBGYN, an obstetrician gynecologist, who will look after your pregnancy from beginning to end up until 6 weeks. They see you for all of your appointments. They scan you most of the time, every time you go in there. And then they ultimately deliver your baby. When you go public, usually it's a shared care option where you would see your GP for a lot of your pregnancy, and then for some big appointments you would go and see maternity unit at your local hospital. Baby's delivered by a midwife. Usually you'd never met this person in your life, but those two options aren't the only options that you have. You can also go through your hospital's local birthing centre. It's called an MGP, Midwifery Group Practice. Now this is completely funded by the government, and what it is you get your own private midwife, and they look after your pregnancy from beginning up until 6 to 8 weeks after you've given birth. You can also hire your own private midwife through a private midwifery practice if you don't get accepted into your local birthing centre. It's pretty much the same thing, but you have to pay for it. And so usually it can cost around $4 to $5 grand out of pocket. With an OBGYN, you can be paying about 10 grand out of pocket. If you need to have a C-section, obviously you have to pay extra for an anaesthetist. You also have to pay for a pediatrician review, pay for a management fee, which is usually around $1,500 to $2,000 for your pregnancy, and then you pay about $100 every time you go and see your OBGYN. So it does add up to cost quite a lot of money if you do choose to go that way. So for us, we chose to go through the MGP, which is Midwifery Group Practice, through our local birthing centre at Gold Coast University Hospital. If we didn't make it into that, we really were adamant that we would hire our own private midwife. Now initially we didn't think that we had gotten into it because we hadn't heard anything. If you listen to my fertility journey, you would know that I found out I was pregnant. Literally I was like 2 weeks pregnant. So I called them straight away and told them I was pregnant. What you do is you call the number, and it's an automated thing where you just leave a message with your name, date of birth, your address, and your estimated due date, and whether it's your first or consecutive pregnancy. And what they will usually do is get back to you within the first 12 weeks. So at around 13 weeks, the MGP called me and told me that I had made it in, which was wonderful because we were going to be saving $5,000. So we took that option, and it was the most amazing experience. We got our own midwife who came to us for most of our appointments. I only had to go to 2 appointments at the hospital. I went for an appointment at around 13 weeks after they confirmed that I had gotten in, where they go through all of my history. It takes like 2 hours. It's so in depth. They ask you about your medical history, your partner's medical history, your immediate family's medical history. And then they go through mental health and domestic violence and all that kind of stuff as well. So don't be alarmed if they start asking you all these questions. It's completely normal. So my midwife's name was Rebecca, and she was a Kiwi girl, and she's absolutely gorgeous. Absolutely love her. And she came, after my first 2 appointments, she came to my house for every other appointment, which was so great. I didn't have to make my way to the hospital every single time. Didn't have to pay for parking or anything like that, so it was amazing. I just got to stay in my comfy clothes and not have to make an effort to get out of the house. One of my friends, Kate, who's a midwife, and she's also a hypnobirthing instructor, she held a pregnancy, birth and beyond expo. And it was so incredible, so completely eye-opening. I just learned so much about pregnancy, health and wellness throughout pregnancy, and different options that I had. So there, I was introduced to the beautiful Meaghan Amour, who is a hypnobirthing instructor also. She's also a pre and postnatal massage therapist and also a doula. Meaghan held her own little birthing presentation at that seminar. We just fell in love with the idea of hypnobirthing. So from 20 weeks, I think it was about 25 weeks, I think maybe, or 22 weeks, we enrolled into Meaghan's hypnobirthing course. And we were absolutely blown away. So before we went there, we thought, oh, it's going to be really hippie. Like, you know, they're going to teach you like how to hypnotize yourself or something like that. But no, we were completely wrong. It's nothing like that at all. We were completely surprised about how much we learned about the woman's reproductive anatomy and the structure of the uterus. That was really, really fascinating. We learned so much about things that we thought that we weren't going to learn about. We thought it was just going to be like meditation and stuff, which it is, but there's so much to learn about the female reproductive system that we didn't actually know about, even me being a nurse. So hypnobirthing is pretty much using deep breathing exercises, using meditation to have a calm and peaceful birth. The one thing that stays with me throughout this course was that if you don't know your rights, then you don't have any. Now, with my first pregnancy and labour and delivery, when I had gotten to Gold Coast, the old Gold Coast hospital, I was 8 centimetres dilated. It took me, from the time I got there, 5 hours to deliver my baby, because they told me that we're going to give you this medication that's going to speed up your labour. But I was already 8 centimetres dilated. So I don't know how much more they wanted to speed it up. But when they gave me this medication, it was oxytocin, which is what your body naturally creates oxytocin when you're in labour, which helps your labour progress. But what it actually does is it blocks your natural production of oxytocin, so it can actually stall your labour, which is what it did for me. So it took me 5 hours to deliver my first baby. From the time I got there, and I didn't know any different. I just thought, you know, they know what's best, they know what they're doing, I'm just going to trust these people, I'm going to put, you know, my faith in them. And so another thing they did after I got there was break my waters as well. It can actually stall your labor, and it can lead to further complications as well. As soon as they told me I was 10 centimeters dilated, they wanted me to start pushing. I didn't have the urge to push, but they wanted me to push anyway. So I was pushing for a good 2 hours before they realized that I wasn't actually fully dilated. I had anterior lip over the top of my baby's head, which is a little bit of the cervix that doesn't come away. So I've been pushing for 2 hours. You know, the midwife put her hand inside me and moved the cervix out of the way so the baby could come down. But after that, because I had been straining to push for 2 hours, I literally couldn't walk properly for about 6 to 8 weeks after I gave birth. Like, I was so sore down there, so pain, like there was so much pain for weeks and weeks and weeks. I really knew that I wanted a different approach to my next labour and delivery, which is why we chose to go with hypnobirthing. There's also something called calm birthing out there, which is quite similar to hypnobirthing, but I'm not too sure the ins and outs of that. We just liked the idea of hypnobirthing, so that's why we chose hypnobirthing. So we learned lots of ways to relax ourselves, how to deep breathe to remain calm, bring ourselves into a calm state. My husband learned so much too, of course, because it really helped him prepare for how he could best help me through our pregnancy and through our labour and delivery. It really, really gave him the tools and the confidence he needed to be able to help me. So by the time that I did go on labour, he was like amazing. He was absolutely incredible. You form a really deep connection with your partner. It's great bonding for the both of you. We felt so connected, and because I had an IVF pregnancy, statistics would show that you're at higher risk of stillbirth or fetal demise or neonatal death within the first 21 days after birth if you go over your estimated due date. Now, I think that statistic was from about 15 years ago or something. Because it's unethical to repeat the clinical trial or the clinical study, they have never done it again. You're not going to find women that are going to want to participate in that, you know, especially after the first lot of information come out. So it was always the plan that if I didn't go into labour by myself prior to my due date, then I would be induced. So my induction plan was that I would come in the night before my due date, and I would have a pessary inserted, which was full of medication that would initiate my labour. And then I would go home, and then the next morning I would come back to the hospital where they would insert a balloon catheter inside my cervix and inflate it to help it dilate. And then they would break my waters and start oxytocin and yada, yada, yada. Now, because I'd done this hypnobirthing course, I'd had a sort of induction, I'd had all of that stuff with my first labour, I really didn't want to do it again. You know, I was fine through my first labour and delivery until they introduced all of these interventions. And so I was really, really hoping that I would go into labour before this could happen. So I went and seen Meaghan, who is a massage therapist, but she also does initiation massages as well. I had 3 episodes of decreased fetal movement in the 2 weeks prior. So they were really pushing for an induction because my placenta had started to calcify, which means that patches of it were starting to fail. The plan was from 38 weeks onwards, I would start getting stretch and sweeps, which is not very comfortable. They literally put their hand inside your vagina and then they scrape around the cervix, something like that. I think I had a total of 3 stretch and sweeps to try and initiate my labour before I would go and have to have an induction. So I also, as well as those stretch and sweeps, I also had an initiation massage from Meaghan, who was really great. If you are pregnant, I definitely recommend going to see her because she is so great. When I had 2 weeks of prodromal labour, which is like false labour, you contract and it's like really steady for a couple hours and then it just stops. Like that was happening to me every single day for 2 whole weeks. It was so exhausting because I was like, oh, it's gonna happen today, it's gonna happen. And then it just fizzled out and died. When I did actually go into labour, I went into labour at about the night before, on the 15th. I gave birth on the 16th. Yeah, on the 15th, I think before I went to bed, I started to feel some pains. But you'll learn in hypnobirthing that you just go to sleep. And I'd already had 2 weeks of this, so I was like, I'm just going to go to sleep and just see what comes of it because, you know, I don't want to be exhausted. I woke up the next morning at around 3 and it was just really uncomfortable. And then my husband went to work around 5 o'clock. I told him, I was like, oh, I'll be fine, just go to work, everything's going to be okay. I knew I wasn't going to give birth for like so many hours, so I was like, just go. Now, this is the one day of like the month that it was my midwife's day off. And my student midwife actually said, she's like, I bet you were going to go into labour on the 16th because that's our day off. And lo and behold, I did. I cruised through the whole day, and around 3 o'clock in the afternoon, my husband came home and we went into the hospital. They made me go into the hospital because they like you to go in if you have contracting twice in 10 minutes. Doing that, I did call my midwife who was on call, and I said to her, I was like, I really don't feel like it's, you know, close. I feel like I've still got like many more hours to go before I do give birth. And then within the hour, I was contracting 3 times in 10 minutes. And by the time I got to the hospital, it was 4 and 10 minutes. My contractions were pretty much back to back. They were every 2 minutes, lasting a minute. But because we had done all of our hypnobirthing, I was pretty much really calm throughout the whole thing. Literally spent about 3 hours in the shower. Yeah, with all of our hypnobirthing practices, I ended up falling asleep in between my contractions, and these contractions were back to back. The only time I was bothered and felt pain was when the midwives would want to come in and check the baby's heart rate, because I told them I didn't want to be continuously monitored because I wanted to be able to move around freely. And so yeah, I drifted in between the bed and the pool. And the pool I don't know, the pool wasn't for me. I feel like it slowed down my labour. I didn't feel comfortable in there. I didn't like the weightless feeling because I've had a lot of pressure in my back, so it It just wasn't for me at all. It got to about 9 o'clock and I don't know, I sort of gave in a little bit and just said to them, okay, fine, you can break my waters. And oh, that was horrible. I don't know why. I'm really disappointed in myself that I did let them do that, because I don't know, I don't know why I did, but at that moment I was just like, fine, just do it, just break them. And then when I did, obviously I'd been coping with my pain so well, and as soon as I broke my waters, it was just intense. It was horrible. So I would try to get back into the water, and my pain was worse in the water. Now, by this time, I'd gone through 3 different midwives because of the shift changes. So by the time I looked up out of the water, I had a completely different midwife. I didn't even know her name. Yeah, I just looked at her and I said, I think she's stuck. I can't feel her moving down anymore. When that contraction had finished, I jumped out of the water and jumped onto the bed. And I know you'll hear a lot of things saying that being on your back isn't an optimum position to give birth, but that's just how I was comfortable. I was so much more comfortable lying on my back and laying in the bed. I felt more relaxed being in the bed. Now, by this point, because I knew she was stuck, I said to them that you could check to see if she's okay. So she did an internal examination, and yeah, she was stuck. Her poor little head was stuck on my cervix. I was fully dilated, but again, I had that anterior lip. So I don't know if this is going to be a recurring thing with my pregnancies, or if it just because my waters were broken, I'm not too sure. But she did just put her hand in during a contraction and did lift the cervix over the top of the baby's head. And again, I didn't have the urge to push, but she had started to descend into the birthing canal. And so I just continued with my deep breathing exercises that I'd been taught in hypnobirthing. And her head was out, and I didn't even feel it. I didn't even feel that her head was out. And I was like, oh, is she there? Is she coming? Like, I was like, and then I felt her head. I reached down and I felt her head. They teach you how to breathe your baby down and breathe your baby out. And so that's what I did. I just breathed, kept breathing. I didn't necessarily push. Your body has this natural reflex where they expel the baby from your body. So, yeah, I didn't even push, and then what do you know, she was out. My husband delivered her and put her straight onto my chest. She was born in meconium, which is when the baby poos inside you. They did have to press the emergency buzzer because it's hospital policy and protocol. So the MET team came in, which is the emergency medical team, which consists of a doctor, a NICU nurse, and an in-charge nurse. So they all come in. Because we had decided that we wanted to deliver our placenta and we wanted to do delayed cord clamping, we were really, really adamant that we wanted this. We didn't want all of that blood to go to waste. The first thing the doctor did when she came in, she was quite young as well, she was a registrar. She wanted to cut the cord straight away and resuscitate the baby. But my baby was breathing fine. She just wasn't crying. She was breathing, she was beautiful and pink. She was just lying there looking up at me and staring at me. Hadn't made a peep at this stage. And yeah, the doctor wanted to resuscitate her. I'm really, really lucky that I had such a strong-willed, such a senior and experienced midwife who really advocated for me. It's told the doctor, why do you want to do that? Why do you want to resuscitate a baby that doesn't need resuscitating? The baby's pink. She's got great APGAR score. You know, there's no need to give her breast via a bag when she doesn't require it. And so we'd just given birth, and our midwife and a doctor are arguing. By this stage, NICU had come in as well, and the in-charge NICU had said to me, she's like, I'm just gonna assess the baby while she's on top of you there. And she said, your baby looks pink, I'm just gonna check her oxygen levels. And she was saturating at 100%. And the NICU team said, she's fine, this baby is absolutely perfect, there is nothing wrong with her. Just give her, a few moments and she'll probably start crying on her own. She didn't actually cry for a whole hour after she was born. After the Met Call team had left and the NICU team had left, she stayed on my chest until I was ready to deliver the placenta. While she was on my chest, I just, pushed gently, and the midwife just tugged on the umbilical cord slightly, and it came out all in one go. And Yeah, it was beautiful. She stayed connected like that and stayed on my chest for a while, and then I took some photos with her and her placenta, and then they cut it, and I've still got that in my freezer now. I've still got my umbilical cord and placenta ready for me to use for whatever in the future. About an hour and a half after I'd given birth, I went for a shower, and my husband got to have, you know, skin on skin with her straight away. And I felt fine. I felt absolutely great. My vagina felt great. I literally felt like I hadn't even given birth. I was a little bit like unsteady because I'd just lost like 8 kilos of baby and fluid and blood. So yeah, I felt absolutely fantastic. I went for a shower and come back out, and I felt great. She was born with meconium. Usually what would happen if you go through the birthing centre is you'd stay for 4 hours, but because she was born with meconium, we had to wait 6 hours. So I delivered her at I don't know, I think it was like 20 past 10 or something like that. We went home at 4 o'clock the next morning, and that was amazing. I really didn't want, I don't like hospitals. I work in a hospital. I didn't want to stay in a hospital. I just wanted to get her home and into her own environment, and just really bond with her. We opted for 2 weeks of no visitors. We let my mum visit, or my mum was there when I gave birth. Our parents were there when we gave birth, and then our best friends came when we got home to visit. But then 2 weeks after that, we had absolutely no visitors. We just really wanted to bond with our baby and get into a good routine, because we already had another child that we had so many things going on. We just needed to get her back into a routine. My vagina felt great. Like, I literally felt like I hadn't given birth, and I really attribute that to hypnobirthing. Like, my mood was great. I think it was a couple days after I'd given birth, my midwife came to visit me, and I'm outside like sweeping up leaves and raking up leaves on the front lawn, and she's like, "What the hell are you doing?" I was just like, "Oh, I'm just, you know, getting back to normal." My husband and I cleaned out the garage and reorganized it, and I felt fantastic. And I really do. I attribute that to hypnobirthing, the calm breathing exercises. I had no swelling down there. No pain. My husband and I like had sex the next week, or like 2 weeks after I'd given birth. I was back playing sport, playing OzTag 2 weeks after I gave birth. But I did stay really, really active throughout my pregnancy as well, because I played so much sport before I got pregnant, and I was able to maintain that throughout my pregnancy. So I still did HIIT training up until 28 to 30 weeks when I was pregnant, and I walked literally every single day of the week. I was walking at least 4Ks Monday to Friday, and I was doing like Burley Hill walk as well, at least once a week throughout my pregnancy. And I ate really healthily as well. I gained 20 kilos with my first pregnancy, and that was just me in the mindset of, oh, I'm pregnant, I can eat what I want. But this time I really was conscious about what I was putting into my body and what I was nourishing my baby with. So I recovered really fast. A lot of people would say that I bounced back quickly, but I think that came down to hard work and consistency throughout my pregnancy. Started playing OzTag again 2 weeks after I'd given birth, and I played OzTag consistently, and I started going to the gym again when she was around, I think she was about 10 weeks. I started going to the gym, and I was going to the gym 5 days a week, 5 to 6 days a week. So by the time she was about 4 months old, I was pre-baby weight. I really would recommend doing some type of pregnancy or birthing class. I think it's a great way to bond with your partner, a great way to really connect, a great way to get to know your body, a great way for your partner or your husband to learn how to support you. That was the biggest thing that we got out of that, was my husband was able to support me, and he was fantastic. Really, really relied and depended on him throughout my labor. Just using him for support. He was there rubbing my back, and just giving me that affection that I needed. Guys, everyone's pregnancy is different. There's no 2 pregnancies that are the same. I really recommend you do so much research about everything. Don't just go ahead and trust people. Don't listen to other people's advice. Do your own research so that you can formulate your own opinion on things. The best thing that I ever heard from Meaghan, our hypnobirthing instructor, was that you wouldn't just rock up to a marathon and expect to do well at it. why would you treat your pregnancy and your labor and delivery the same way? You want to train yourself and you want to prepare for it the best you can so that you can have the best possible outcome. Guys, you have so many options. There's so much to learn about pregnancy. There's so much to learn about labor, so much to learn about your delivery and postnatal care as well. Formulate an opinion for yourself. Don't listen to other people, and because what worked for someone else may not work for you. Every single pregnancy is different. There are no two pregnancies that are the same, no two labors that are the same. So you know, just take people's advice with a grain of salt. I literally cannot wait to go through this whole experience again. I have said to my husband that the next time I will most likely hire a doula, because I think it will be such a great experience to have another support person there, as well as my husband, who knows what we want, what our ideal outcomes are, and someone who can advocate for us so that my husband can just focus completely on me and not have to worry about anyone else. But I can't wait to do it all over again. I love being pregnant. I love babies. I love giving birth. It's just such a magical feeling that we are so lucky to be able to do. Like, guys, we are literally superwomen. Like, we are superheroes. We can grow a whole actual human inside of us. Like, that is ridiculous. Babies start off literally tiny. They're atomic. And it blows my mind that they go from this tiny little speck to this full-blown baby in 9 months. And we do all of that. Our husband donates his sperm, but we grow the baby. It's incredible. And our bodies go through so much to be able to do that. So I just want to leave you with, guys, just do your research. There's so much to learn out there. There's so much that you can incorporate into your pregnancy and into your labor and delivery that you may not even be aware of. So just, you know, go out there and do the research, and I'll link some things that I feel like might be beneficial to you in the description. I really hope that you enjoyed this video, something a little bit different from my last 2 weeks. And I hope that you have a beautiful and blissful pregnancy. Congratulations to all of you who have just had little babies. And I hope that you thrive in this postnatal stage. It's such a beautiful moment, and I really hope that you are enjoying your little babies and all the good stuff that comes with it. Next week, I'm going to sit down with my husband because I think it's great if you hear his side of our fertility problems, pregnancy and labor and delivery. I think it's so cool hearing a male's perspective of all of it. So I hope that you will stay and join us for that. So thank you so much, and I will see you all next week.